Hi everyone, congratulations on finishing your first year and welcome to second year MBBS. I hope this year goes well for you. Before you buy a pile of books that you might not ever open, let's discuss all the books that you'll ever possibly need in your second year. Hi everyone, my name is Apurva. I'm currently a third year MBBS student at GMC Ratlam, and today I'll guide you through every book that you might ever need for second year. Basically, the types of books that you might run into. First, we have gold standard books or the standard books. These are the books that your professors want you to read. This is very, comprehensive in matter about the subject that it deals with, and it has a lot of details. Basically, it may be an Indian author, it may be foreign author, depending on the needs or the subject or your interest at the same time. Then we have the review books. Review books are like short and sweetened version of that subject, sort of like notes. Okay, starting with pathology, the first and the best book, personally speaking, I would recommend is Robbins is the book you'll ever need. It is beautiful. Everything is written in a very easy to follow manner. Everything is very pretty, I would say. Robbins is like that one old professor that you really enjoy studying with because he makes things very easy to understand for you. So basically, this book is the holy grail of pathology. If you know that BDC is the holy book of anat, this is the holy book of pathology. I would say give it at least one shot before you like not read it at all. However, the problem with this book is it is not very exam friendly in the sense that it is not ready to be copy pasted. It is not formatted in the manner of subheading, headings, bullet points, which you may be familiar with from your first year. However, I would say it has great flowcharts, beautiful diagrams. The boxes in Robbins are very high yield, especially the histo part. So I would say give this book a go. It is beautiful and honestly, it will make you start liking the subject. Moving on to Harsh Mohan. Now, this is a book for people who find Robinson harder to follow. They don't really like the language of the book. So, this is Harsh Mohan. It is very detailed, and this is very similar to the other books you might have read in your first year. It is formatted in bullet points, it has subheadings. You can just copy paste this into your exam and you'll score just fine. However, I would say Robbins is a great book. Give it at least one honest shot before you reject it entirely. I personally followed Robbins through the entire year. Moving on to review books, we have Ramdas Nayak. Now, this is a shortcut book basically. This is the book your seniors might ask you to read if you go to them a night before the exam and be like, I have not read anything, I just want to score decent enough. This is the book. It is very short, it is last moment. Do not refer this book from the beginning of the year, or else you'll miss out on a lot of good concepts. Similar book is Pathoma. If you don't like Ramdas Nayak, Pathoma is also a great source, but not something I would recommend again to be followed from the beginning of the year. And then we have Prof Buster. Like these are basically notes, right? So if you are having trouble figuring out how to write an answer for a certain topic or how to present the answer, this book is shortened part of that, I would say. Follow this if you do not understand the topic at all, you are in a pinch of time. But otherwise, please refer to either Robbins or Harsh Mohan. We have pharma, all the drugs at the same time, right? So I understand it might be a little more difficult for you to follow through, starting with KDT. KDT is the golden book. I know it is a little bit hard to follow through if you've read it already, but this is a great book. It has everything you need for your university exams. However, the formatting is not very beginner friendly. It might feel heavier for you to follow through. And if that is the case with you, we have Sharma and Sharma. Sharma and Sharma is KDT but in different clothes, I would say. It's the same book. Formatting is a little more friendly towards a first reader, I would say. But more or less the content is same. It doesn't really matter if you follow KDT or Sharma and Sharma. No? Then we have this gold of a book. Kazang is a beautiful, beautiful, beautiful book if you want to have a very deep understanding of the topic. Again, it's like Ganong if you were to refer it to your first year, right? You don't read this book as the first reading of the subject, and you cannot read this book for the entirety of the subject. It's very lengthy, you'll never finish your syllabus. But it's great for building a deeper understanding. For example, KDT might tell you the pharmacodynamics and kinetics of one prototype drug and tell you almost every other drug follows the same. Kadzan will tell you how each drug is different from the prototype drug, how addition of a methyl or an alcohol group changes the metabolism, the elimination, and all that stuff. These things are not usually asked in Indian exams, so I don't see the need to like follow it through the entire semester. But I would say go through this for maybe general pharmac, more than enough. But it's very lengthy, it's very detailed. You may or may not like it. Follow it only if you like the subject. Then we have the shortcut books, the review book. Now this is the book that I personally followed for my last moment preparation. This is great. It's very easy to follow, and it's formatted in a very beginner friendly format. It's very well organized. Then we have Shanbag. Shanbag are basically notes of KDT. It's a review book again, but it's detailed enough, I think, and it's much more easier to follow than KDT is. Again, do not follow Shanbag from the beginning of the year if you can follow KDT or any other standard book. But if you feel like standard books are not for you, I would say you can shift to this book. It's not that bad of a deal. And at last, we have another review book by Uday Kumar. You might not need this book if you go through Gulati or Shanbag well enough. Moving on to the last subject, which might feel shorter at first, but very lengthy once you go through the syllabus. So we have micro now. So in micro, this is the holy grail. Like everything you need for the subject is very well formatted, and it's written in a very easy to follow manner in this book. This is Apurva Shastri. Beautiful book, literally all you can need. And there are boxes in each chapter, right? Those are lifesavers. So for example, if you're trying to learn the lab diagnosis and it's like 3 pages long, this book will have a small box at the end or the beginning of that, where everything would be given in a bullet point summarized manner. It's a great addition to the book, I would say. Moving on to Anant Narayan and Panikar. Now, this is the same content. However, the formatting might feel slightly heavier and slightly monotonous than Apurva Shastri. I feel like this book has less images than Apurva Shastri has. But again, whatever suits you, this book is also good enough for you to follow. Then Baveja is again same content as Shastri or Anant Narayan with a slightly different formatting. I would say just go with Shastri. If you can't, then refer to these books. Then we have for extra reading, we have Panikar's Parasitology. Now, for extra reading is only because if you really, really like the subject and you want to go into a deeper understanding. I fell in love with micro and during my second year, so I went through these extra books. This is great. Like Parasitology, I would say if you don't want to study it from Shastri, Panikar is your to-go book. It is the only thing you are ever going to need for parasitology, at least. Then we have this hulk of a book. This is very extensive. It is confusing at times, and it might not be the easiest book to follow, but it has so many details. Read this only if you're interested in the subject as the subject itself. But yeah, it builds a very deeper understanding of how things are going. And if there is any factual discrepancy, this is the book I used to refer to. So yeah, that is it. I hope you have a great second year. And these are all the books that you'll ever possibly need. My only advice would be follow only one book per subject and stick to it throughout the year. Don't try to cross refer a lot of books because there is a lot of content. There is a lot of clinical correlations. You do not need it like 5 different books to go through that. I hope this helped. Thank you.